Welcome to Regent Park TV. I'm Gabriel Meissner, and today we bring you a special coverage by community reporters Thundercloud and Fred Alvarado. On May 3rd, 2024, the Toronto Council Fire Native Cultural Centre welcomed members of the Downtown East Indigenous communities to the Community Health Gathering 2024. This event served as a vibrant platform for urban Indigenous community members, serving providers, and allies to converge and exchange invaluable insights on holistic health and well-being and networking. The event saw a remarkable turnout, with key organizations in attendance, including the Women's College Hospital, Centre for Wise Practices in Indigenous Health, Anishnawbe Health Toronto, NCCT Native Canadian Centre of Toronto, Toronto Public Health Dental Clinic, Indigenous Diabetes Health Circle, among others. Crucial information about resources like the UHN University Hospital Network, Indigenous Patient Navigator was shared, offering vital support to those within the cancer system who identify as First Nations, Inuit, or Metis. Red Bear singers filled the air with Indigenous songs and hand drums as attendees engaged in the 7 grandfather teachings: wisdom, love, respect, bravery, honesty, truth, and humility. This inclusive gathering, free to all, showcased community activities, door prizes, and light refreshments. It underscored the critical need for comprehensive and holistic support for Downtown East Indigenous communities. This support encompasses spiritual, physical, mental, and emotional well-being, as well as providing counseling, material aid, and other essential services to First Nations individuals throughout Toronto. Among the attendees was Thundercloud, a beloved member of the Regent Park community, well known for her roles as a meditation guide and community journalist. As Thundercloud and Fred immerse themselves in the event's vibrant atmosphere, join us as we uncover the essence of this gathering and delve into the stories that make it truly special.
Hello, I'm Thundercloud from Regent Park TV, and I'm at the Indigenous Health Fair gathering in Corktown, which is Regent Park and also called Cabbagetown. Here today we have Gina Lefebvre, a community member. And how are you enjoying the health gathering, Gina?
Oh, I'm having a wonderful time. I've met a lot of different booths from an Indigenous agency, public health agency, different other agencies regarding chiropractic, let's say, or something to do with mental health. But I've went to all the booths and they were very welcoming. They're giving out a lot of little, little pens and little gift bags or bags and information, and they're very welcoming. And they had like a paper where you can go around and you get it stamped, and then maybe you'll win a prize at the very end. It's almost like a bingo, you get all the stamps done and then you get a prize. Thank you, Thunder, for welcoming me, inviting me to this event. And for all the sponsors of this event, they did an excellent job of informing the community. And there's a lot of representation, which I like, for seniors, which I soon am going to be a senior in about a year. So I got a lot of information to help myself as well. Thank you. And I'm grateful for this event. And they should have more of this for many other communities as well.
So thank you to Council Fire, the Ontario Federation of Indian Friendship Centres, and University of Toronto for sponsoring this wonderful event. And it seems like Gina's having a really great time here. So if you're local, this happens annually, so come on over and check it out.
My name is Amanda.
And here we have Amanda from Council Fire. And Amanda is our greeter at the health fair.
It's been a great day so far. It's a beautiful day. We're in a beautiful space, and we have had a great turnout of community coming in to visit all the health booths. So we've got a really good selection of health booths and services in the area to showcase what they can offer the community, but also so they can work together so we can know what each other has to service the community. Because a lot of times there's so many programs and good things going on that sometimes we don't know what each other's doing, and we can support each other, right? Because there's so much work to do out there. So the more we work together, the better it is.
So there's a lot of good networking happening at this event.
That's correct. And a lot of good handouts. We're going to go around at about 2:00, and we're going to interview all the different booths. Just get for them to tell us what services they offer. And then we're going to have a hoop dance demonstration at about 3:30. We did have a nice selection of food, but that all went quickly, as food usually does. Healthy food, always, yeah. So it's been a really good turnout. I'm really happy with it. And I think it being a sunny day, it always works in our favor.
Very kind.
Yeah, that's what we try and promote, right? Compassion, kindness, the 7 grandfather teachings. Try and live by that every day. And that Council Fire,
all those important things.
Exactly. And Council Fire is very authentic that way. So we've got a really great team that knows what they're doing. Yeah, for sure.
Well, thank you very much for your time.
My pleasure. I'm glad the more we can spread awareness about the services that are available to help, the better. So thank you for coming.
Certainly. It makes a healthier community and world, doesn't it?
Exactly, and that's what we need. We need to be healthy and well, all of us, right? In body, mind, and spirit. So.
Exactly. Body, mind, and spirit.
Yep. Awesome. Thank you. Miigwech.
Hey, miigwech. Hello. And who do we have here?
Hi, my name is Rachel Nungna. I'm from Baker Lake, Nunavut. I'm from Kamnitwa, and I'm the coordinator for the Ontario Inuit Cancer Program. So I work with Tungusivinga Inuit, and we do smoking cessation, and we do food security. We do a lot of services, so you can just contact us through Facebook, email.
So my name is Sheena Taylor, and I work for Tungusivinga Inuit. It means a place where Inuit are welcome, and we serve the Inuit community in Toronto. And I'm here with 2 of my coworkers from Ottawa, who are in the cancer care program.
Welcome from Ottawa.
Yes.
We're in Toronto.
Most of our work is based out of Ottawa, but we have an office here in Toronto as well.
That's wonderful. So how do you like the big city here?
It's great.
Great. Yeah. What's your purpose here?
We're here to share information about our Ontario Inuit Cancer Program. So we are slowly but surely expanding our services to Toronto as well, to Toronto Inuit community. So we have services like smoking cessation workshops, cancer screening, support and navigation, and healthy eating initiatives that are coming up. So
that's really wonderful and great to know that there's all this support for healthcare. And who do we have here from Ottawa?
Felicia Delaja. I work as the manager for the cancer program at Tungusivinga Inuit. It's good to be here.
Well, thank you, miigwech.
Thank you. And everyone loves spinning the wheel. It's always a hit. Miigwech. Okay, moving on.
Gwe Delawusi Iswa Wickel Baptism. So what I've said is hello. My name is Circling Wolf. That's my spirit name. My tax name is Leonard Benwall. I am Alibu Mi'kmaq. Come from Burjo First Nation on ceded territory of Newfoundland and Labrador. I work at UHN as an Indigenous Patient Navigator. It's all about building relationships with community, building relationships with of course, other partners, making sure that when folks come into hospital and into institutions, they can feel safe. And the whole purpose of our program is making sure that people get connected to good quality care, they have the best possible outcome.
Hello, my name is Audette Fabian. I am a new hire with UHN, specifically in the Indigenous Health Department and the Social Medicine Department. So I'm a hybrid role. My titles are Indigenous Community Healthcare Worker as well as Indigenous Social Medicine Navigator. So I'm tied between 2 different programs, but whereas my coworkers here work in the emergency department as well as service the downtown area. I will be mostly aftercare and follow-up in the community. So I'll be helping community members in the GTA access services or find pathways that they need, or navigate any barriers they may encounter, access nurse practitioners, connect them with housing, connect them with any opportunities they may need in order to help their situation.
So if anybody ever needs any help at any of our sites, please reach out to any member of our team, and we'll be able to try and figure out who can help. We are a small team covering 3 different parts of the city, which is quite broad. So we'll try and be able to attend to people's needs as quickly as we can here. We also have a First Nations, Inuit, and Metis community advisory panel at the hospital. So we're looking forward to having anybody join us to continue to provide good advice. I'm hoping to launch a community session in the fall to kind of let folks know the results of our engagement session. I want that to happen back to community first, so all those individuals that participated will be invited to hear the results and what we're doing about it. So holding the community feedback in a good way and being able to respond with transparency about what we're doing about our problems in our institution is what I'm trying to do in the best way possible. We're also doing a hard launch of our first Indigenous wellness space at St. Mike's, hopefully by the end of September.
That's fantastic.
So we will invite the whole community out to come by to an open house to come and see our new digs.
Why are you at the health gathering today?
My name is David Craig. I'm a dentist. I work for Toronto Public Health, and I'm here at the health gathering representing Toronto Public Health, trying to get oral health education, information to the community. We're offering dental screenings today and just trying to raise awareness for oral health, and that's why I'm here today.
That's awesome. I'm very happy you're here. I went to see my dentist yesterday, and it's not always easy to get dental care, so that's wonderful to hear you're here and you're doing the screening, so you're checking if people need to go to the dentist and get some care?
Yeah, so screenings are for anyone who wishes a screening. We're here providing it. I'm a dentist. We have a hygienist here today. We have a denturist here today. So anyone who has questions about our program, we're answering them. And we can take a look under the hood if you want to. We can take a quick peek. And then if we're also trying to set up appointments for anyone interested, they can come to one of our clinics and we can take a closer look.
Excellent. I'm really impressed that we have a dentist, a hygienist, and who else? And Matthew, our denturist. What's the process of getting the look under the hood, as you say?
Well, we at Toronto Public Health, we offer full services to people who are low-income children, low-income seniors, people on government assistance programs like Ontario Works, Ontario Disability, IFH. So once we determine if you do qualify for one of those programs, we can bring you in and get started. If you don't qualify for one of those programs, we can point you in the right direction for how to find other low-cost options. So it starts with a phone call for that look under the hood. Give us a call.
So I'm also seeing a sign that says kids 17 and under may be able to get free dental care.
Yes, that's Healthy Smiles Ontario. 17 and under children who don't have any dental insurance, they can be seen by our dentists. A lot of other private offices accept Healthy Smiles Ontario too. But again, if you want your child to get free dental care, start by giving us a call. We can help you get registered for the program.
Could you do a little talk on what the situation is in Ontario for seniors' dental care? I'm referring to over 65. Can you just give a little mention about what's going on with that? Because I've been speaking to my mother, who's 85 years old, and she was telling me at one point there wasn't any coverage. But that seems to change now. Can you speak on that, please?
Absolutely. So my program is funded by the provincial and municipal governments. We offer comprehensive dental care to seniors. Ontario Senior Dental Care Program. You can apply online. You can bring a notice of assessment right into our clinics. We establish your low income and if you qualify, and then we can do full basic treatment, cleanings, checkup, fillings, root canals, not things like implants or bridges, but we can replace teeth with denture services. So yeah, comprehensive dental care is available for seniors. The first step is just to once again call us. We can help you register.
Thank you. You're a wealth of information. And don't forget, smiles are free.
Hello, my name is Jerry Gogo and I work for the Native Canadian Centre as a youth case manager. We're here today promoting all of the services of the centre. We have several different departments from early-ons to youth to adults to seniors. We have cultural department as well as our enterprise department where we put on our markets and our business training programs. This is my colleague Jennifer, our community health navigator.
Hi, Jennifer.
Hi.
How are you today?
I'm good, thank you. So Jennifer Hammond, I'm the Community Health Navigator at the Centre. It's my second year in this role. We have a harm reduction based program. We have our women's healing and men's healing circles. We do community outreach where we bring harm reduction supplies out to community. As well, we run clinics throughout the year at the Centre for hearing, vision, dental, hygiene, and I think that's about it.
Wow, you've covered a lot. That's really impressive that, you know, you have all these programs that have developed and you're offering over many years of the Centre being open. And I've been going to the Centre for many years as well. And just, excuse me, who do we have here?
Hello, my name is Wanda. So I do the payroll benefits and I dabble in HR. So yeah, so I won't repeat everything. We have a lot of programs. I'll talk about the early on. They're all over the Toronto area, and they also have programming once a week at the Centre. There's a great online website that you could go to, and it shows you all the information you need and all the contacts you want to contact for staff.
Some of them were not so kind to Indigenous people when they came into the hospitals. They seen them as people that had trouble, who were alcoholics, who were addicts, and they didn't treat them so well. And so what I'm seeing and what I'm hearing is it just takes that time to really understand each other, to take the time to talk and to connect and really understand each other and see each other as human beings first. A lot of times medical institutions don't see us as something that, you know, that we belong here. And because of the intergenerational trauma.
My name is Lori Okimawanu.
Welcome, Lori Okamawan. And what is the importance of the Indigenous Health Gathering?
For me, like I mentioned earlier when I spoke, I feel like the importance of this gathering is to really bridge the gaps between the healthcare system and Indigenous people. Often that our Indigenous people go into hospitals and they're unseen or seen in a different way. So I think it's important to bring these healthcare providers here to really see who we are as a people and be seen as people. That's important.
What have been some of the highlights of the day today? Who did we have here?
Oh, for the highlights of the day is really, I mean, we invited people that we know that are going to, that we know that are already doing the job of bridging the gaps with the community, right? So we invite them out, and we invite our community out to say, hey, these are people that are working with us. They're safe. You're safe in their hands, and you can trust that we brought them here, you know, so you can have those services and feel that you are going to be taken care of as an Indigenous person.
Bridging the gaps so we don't fall through the cracks.
Exactly. Oh, absolutely. That's an awesome.
And that we're supported.
Exactly, yeah. And being supported in a holistic way, right? As Indigenous people, we often don't deal well with the Western society and health care, right? And also holistically, we want that kind of care, right? And so, because we're spiritual human beings, so we just, you know, appreciate that kind of care. Council Fire is an Indigenous cultural friendship center, but we service Regent Park. We've been providing meals to Regent Park residents and people that come and use our food bank. And I mean, we offer cultural, traditional aspects of all the entire family, right? And we also reach out to our non-Indigenous allies to support us in this community as well. So we've been a big part of Regent Park for many years. We've serviced Regent Park for many years, but that's not the only community we serve. We service the entire city of Toronto, especially the Indigenous community. So I think the impact that we have on this city is huge. It's huge. We reach a lot of Indigenous people. Yep.
Yes, it is an incredible service, I call it. We serve so many people. I've worked at Council Fire as well, you know, done storytelling for children. And it's been, you know, through COVID, it was just incredible, like many meals a day and everyone welcome. Love the 4 colors, and that's part of the medicine wheel. Exactly.
Yeah, it's part of the 7 grandfather teachings, right? To show humility and to, you know, just to give to all community. And that's really what we want to see as Indigenous people, is to be giving, be kind, be caring, and going back to the original ways of living and knowing and doing. And if you do that, then it will be an easier place to live, you know. We live in a huge city. There's tons of people. They say we're a melting pot. They say we're whatever. We have many names. But what I'd like to be seen and known as is a kind person that was willing to help somebody else out. And that's what we do at Toronto Council Fire.
Yes. Kindness makes the world and the city a warmer, better place, and it strengthens the circle as well.
And that's what we believe in, the circle. Yeah, the circle needs to be tight. And I wish we did we were going to do the dream catcher, right, today, and we didn't get to do that. But that web and all how we are all connected, no matter what race we are. We're all connected. We have a service to do. And to me, that's what I believe. We're put on this earth to be service to others. And yes, we have to enjoy ourselves and our lives while we do that. So, and I do, and I enjoy myself.
And you do it very well. It's been a pleasure to meet you, sister. Yes. Miigwech. Today we had the opportunity to speak to outreach workers, frontline workers, dentists, and many other people in the healthcare services and centers who oversee children's programs, seniors programs, and it's been just so supportive to see that there's so much available over so many years, and it really was a wonderful networking event and community event. Miigwech, it's been awesome.
Don't forget to like, comment, share, and subscribe to our YouTube channel, and check out all of our social media platforms. For more information, check out our website.